Hi, this is Dr. Bharadwaj. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on investigations. There are no specific lab tests or any radiological examinations for this. The entire diagnosis is through observing the child and taking the history from the child. It is very important for you to understand a bit of anatomy and a bit of physiology so that it will be easy for you to understand other things. There are basically two things in your brain. One is neural circuits and the other is neuromodulators. Neural circuits are the physical places in your brain. Your body has the physical parts, right? In the same way, your brain will also have the physical parts. These physical parts are connected through the series of network that we call as neurons. The series of neurons connecting different physical parts in the brain are neural circuits. These both constitute neural circuits, and these neural circuits run or operate with the help of some chemicals. These chemicals are known as neuromodulators. To understand this, you have to understand two things. One is neural circuits and neuromodulators. And what type of neuromodulators or neural circuits involved in this ADHD? There are two types of neural circuits. The two types of neural circuits are default mode network and task mode network. What is meant by default mode network? There are three physical areas in the brain, and they have specific names for it. First one is dorsolateral prefrontal cortex. The second one is posterior cingulate cortex, and the third one is lateral parietal lobe. These are the three physical areas of the brain which are connected through neurons. These are known as default mode networks. In the same way, there are task mode networks. Task mode networks involve two physical areas in the brain that are connected with neurons. And the neuromodulator involved here is dopamine. Dopamine is a main neuromodulator. There are other neuromodulators as well, like serotonin, adrenaline and noradrenaline, but dopamine is the important neurotransmitter or a chemical that is very important for our discussion for ADHD. Then what is default mode network and task mode network? Basically, there are two states of your brain. When you are not doing anything and you are sitting idle, so these default mode networks will activate. So these are the three physical parts in the brain. So these are excited when you are not doing anything. When you are doing something, your task mode networks are excited. So when you are working on something, your default mode networks are inhibited and your task mode networks are excited. There are two physical areas of the brain for task mode networks. These two physical areas are excited in your brain. So there should be a seesaw. When you are not working, your default mode network should be excited and your task mode network should be inhibited. When you are working, your task mode network should be excited and default mode network to be inhibited. This is the normal physiology. One more important thing you have to remember here is neuroplasticity. Neuroplasticity is the ability of the brain to modify itself physically and physiologically, both structural and physiological, means secreting the chemicals for achieving a task. Your brain has to be molded or both physically and physiologically so that you can perform better at a sport or better at a task, better at some swimming, better at singing, better at dancing. So the ability of the brain to modify itself for certain behaviors is neuroplasticity.